We are back this week with another installment of Hot Topics in Cosmetic Medicine. I'm joined by my social media manager, Desiree.
Hello.
And today we've got a lot of cool topics we're going to discuss. We're going to talk all about Zack Efron and his facial changes. We're going to talk a bit about this crazy story out of Florida. It seems like all the crazy stories come out of Florida.
Any story.
About this woman who died after having plastic surgery by her husband. And there's some just crazy details coming out about that. We'll talk about some new statistics in plastic surgery, fillers, and a bunch of more hot topics. So how have you been? I think it's been a few weeks since we did one of these. Anything new in your life?
No, I'm going on vacation a week from today.
Sauna all.
Oh, is it a week?
I'm
so
excited.
You're heading on your cruise, right?
Yep. So excited.
So what are your stops? You said, I think you told us before.
Yeah, we're going to Coco Cay and then the Bahamas to like snorkel.
Yeah, that's
and then the Dominican Republic to swim with dolphins.
Oh, nice.
And then back to Coco Cay because we were supposed to go to Haiti, but there's like all that stuff going on. So they said, no, we're not going.
Yeah, Haiti's got, it's interesting because there's Labadee, which is in Haiti, and it's like the northernmost part of Hispaniola of that island.
Mm-hmm.
And that's where the cruise ships used to stop at. But like Haiti is insane right now with all the
political stuff.
Yeah, militias taking over the
gangs.
country. And so, they recently stopped that because my father-in-law kept saying that he wanted to go to Haiti. He wants to go to Haiti. And we're like, Haiti's terrible. But supposedly there's this one area that's supposedly okay, but now I heard that they canceled it. I've been to Coco Cay before, and that's nice.
I'm excited.
Nice
I've heard
stop.
good things.
Yeah, it's got a nice beach. At least when we went there, if I remember right, they have like all the different like
The
stuff for you
slides.
to go out on, and it's that's a lot of fun. Well, we just got back from Paris a couple weeks ago, and that was quite the experience. We did a quick trip because we had basically a fairly small window of opportunity, and the Olympics will be going on there pretty soon, and so that was really interesting because the city itself they were making changes for it. So there's all these like rafters and bleachers that they're setting up. They're like all around the Eiffel Tower, and the Eiffel Tower every hour at night, the whole thing sparkles. It's like really cool for like 10 minutes. Yeah. So it was really cool. And we ate a lot of pastries. So much. The thing with Paris, and they say in Europe, if you are gluten sensitive, a lot of people find that now, if you're celiac, it doesn't count. But if you're gluten sensitive, a lot of people who can't tolerate the gluten here in the United States go to Europe, like they go to France and Italy, and they can actually tolerate it. It's this interesting phenomenon. And people here in the United States will say that that's because the gluten, the wheat here is poor quality, that it could be the glyphosate, the Roundup that's sprayed on it. We don't really know, but for some reason you hear that from a lot of people that say, geez, if I have gluten here, I feel real crummy, but then I go to Europe and I have as much bread and pasta and I feel fine.
Wow, I didn't know that.
It's kind of an interesting thing, but Paris, it was good. We went to the catacombs one day. Have you've heard of the catacombs?
Yeah. There's a movie. It's like, I think it's called As Above, So Below. It's like people go into the catacombs and they get stuck.
It's crazy. I went to the ones in Rome a long time ago, but this time we brought our kids, went to Paris. So you walk down, like it's like a spiral staircase. You go down something like 200 steps. And then you go below like the sewer level, you go below all the water lines, everything like that. And then you're in these caverns that they basically used to bury people back in the day because of disease. They were worried about disease and stuff. And it's such a huge city that there's like no place to put these. So you walk around and literally there are just like 10 feet wide of just bones all stacked on top of each other, skulls and femurs. I was trying to like figure out like, okay, there's a femur, that's a humerus.
Put the body together.
And like, and the skulls are only the top, like the mandible's gone because who knows where that's sitting at. And they're just stacked in like these huge walls of just bones. And it's just millions and millions of people, I guess, down there. It's kind of freaky. I guess they've had concerts down there, like at night and stuff, where people have like, it's freaky, but it's worth checking out if you're there. So that was our big thing over the last few weeks. We went to Paris, had a good time. And today we're going to talk about some hot topics in cosmetic medicine. Let's start with something on the light side, and then we'll go to something a bit heavier. The first topic is a famous celebrity, Zack Efron. So if you are a fan of Zack Efron, you probably saw him in High School Musical. He was in, what was that movie he was in with?
Was it Matthew Perry?
No, he was like a frat guy and Seth Rogen. Yes.
Is it called Good Neighbors?
Yeah, Neighbors.
Like
I think it was Neighbors or something. That I thought was hilarious. He was in that.
17 again. That's my favorite one.
Well, and then he was just in, which I saw actually on the plane heading to Paris, that movie, the wrestling movie. Oh, what's the name of that? Iron Claw, yes. Yeah, based off of the Von Erich family, which was really good. So several years ago, he hit the scene after being gone for a little while, and he looked very, very different.
Yes.
His jawline looked much wider. He looked kind of puffy in the face. His lips looked a little puffy. And a lot of people were speculating at that time that he had plastic surgery. Now, I erroneously speculated thinking like, people are like, oh, he had filler and all this stuff. And I'm like, I don't think so. Maybe he had his wisdom teeth out, which a dentist, the Bentist actually on TikTok, if you may know, he did disagree with my analysis, which, hey, you know what? He would know better than me.
Right.
So that's fine. So it turns out that, after all this speculation, he said that he actually fell. He tripped while he was at home and he broke his mandible. He broke his jaw. He struck it so hard, he shattered his jaw. And when you break your jaw, typically what happens is you've got to plate it. We put actual metal plates. I've done this back when I did reconstructive surgery. You put metal plates there. Typically you go through the inside of the mouth to make the incisions, or if he's got a cut on the front, you can go through that. And you put these titanium plates to essentially screw and plate the bone back together.
Wow.
And then what you do is you put on these fancy essentially braces, and typically you wire the person's mouth shut because you need to prevent the jaw from moving so that bone can heal. So he claims that this is what happened. He had shattered his jaw, and then after that, it caused the muscles of his jaw to work differently, and that's why his jawline got so much wider. What do you think? Have you had a chance to look at his pictures?
He does look more normal now, so that's why I was like, maybe it is true, but I was like, what if he got filler like all those years ago and like it's finally gone or it dissolved?
There's a lot of people who do believe he had filler done. Yeah. I think it's possible. I don't know. Like, I guess I look at him as kind of like a guy who I just don't see him plumping his face full of filler. And I don't know him. I've never met him, but I kind of give him the benefit of a doubt that he's not like, he's a young guy. Like he's not typically a common filler patient. I mean, how many men, like how old is he?
I think he's 36.
Yeah, 36. How many 36-year-old men are calling our office wanting filler?
None.
Like
0.
Yeah, 0. Yeah, I mean, you answer the phone, so you know. So that's why I'm kind of like, I don't know that it was really that. I do think when you look at his face, it does look very different. Yes. And in Iron Claw, I thought it looked different too. I kind of believe that what he said is that he probably shattered his jaw. It's possible that when they put the mandible back together, maybe he's got some overgrowth of his masseter muscles, which are the muscles out here, which is what they're claiming. I mean, I could see that, I guess.
I feel like his chin looks funny though still. It still looks very wide compared to how he used to.
It really does.
Everybody knows him like from the younger looking him. So I feel like any change in him, they're going to be like, oh, like he did this, he did that.
Well, another thing is, and this is complete, I don't know, but I mean, it could be steroids. If you see him in Iron Claw, like he is massive, like he is built. I think he gained like 30 pounds of muscle for that movie.
Jeez, okay.
And taking steroids will change the shape of your face. Yeah. It's like growth hormone. Like it will cause your brows to get thicker, your jaw to get wider. There are certain professional wrestlers that you can see, they've been on the roids for a while, and you can see how their face changes. You age and stuff, but you can see with some of these professional wrestlers where their brows will actually get heavier and thicker. The jawline gets thicker. Obviously, they get beefier and stuff, but it's not just that they get muscles, their face changes too.
Yeah.
And human growth hormone can do that to you. There's actually a medical condition called acromegaly where you have overgrowth of human growth hormone. Usually it's due to like a tumor. And people who are fully grown, their actual face can change shape. There was a patient of mine whose mother came into my office. The patient came in for like minor operation. No, actually it was the mother that came in. The mother came in because she felt that her face was too masculine looking. And when I actually looked at her old photos that she brought in, she looked nothing like she used to. Like at some point in time, she developed acromegaly and all of her features grew.
That's scary.
Looking like, you remember Andre the Giant? He had acromegaly and kind of in that direction of the facial shape. And so we diagnosed her. I sent her back to her doctor and they found a tumor. But by then, the bone growth had already occurred, but they did find it and were able to prevent the progression of it. And we did a couple of operations. We did some fat grafting. I think I did her eyelids to kind of help her. But I don't know, that could be something too that we're seeing with Zack. I don't think it's as simple as he's had a bunch of filler. I do believe that it may be a combination of aging, weight gain from all that muscle, maybe, human growth hormone type stuff like that. Yeah, it's interesting.
Either way, he looks good to me.
And that's a good movie. If you get a chance, Iron Claw, I really enjoyed it. Okay, so we've got this crazy story coming out of Florida that I think you all are going to find really interesting and
Unsettling.
Unsettling is probably a good word for it. Disturbing. So let me just read. This is from the New York Post. A Florida plastic surgeon has been charged in the death of his wife, who went into cardiac arrest while he was performing a number of cosmetic procedures on her and allegedly refused to call 911 for nearly 20 minutes as she died on the operating table. Benjamin Brown, age 41, turned himself into authorities on Monday after a warrant signed by a judge Friday charged him with second-degree felony homicide, manslaughter by culpable negligence for the death of his wife, Hillary Brown, age 33, last November. His wife was scheduled to undergo, quote, miniature muscle plication / abdominal scar revision, bilateral arm liposuction, lip injections, and ear adjustment procedures, unquote, on the day she went into cardiac arrest. On the morning of the surgery, Hillary, who has no formal medical training, prepared her own IV bags and ingested a handful of multicolored pills, which included Valium before the procedure, the medical board found. She got her own IV bags together, took pills on her own. When she went into the operating room, he administered additional anesthesia without being able to verify what his wife took, according to the report. He also failed to record what anesthetic medication and dosage he administered during the procedure. Benjamin then allowed his wife to suture her own skin after the initial scar revision surgery.
It's ridiculous.
As her husband began the second procedure of liposuction on her arm, she became restless and her feet began twitching. Hillary Brown stated that her vision started to blur and she told Dr. Brown that she saw orange, the report claims. However, after a short break, he moved on to her lip injections despite his wife showing signs of lidocaine toxicity. Dr. Brown continued injecting lidocaine when Hillary Brown became unresponsive and began to have a seizure on the operating table. Over the next 10 to 20 minutes, a medical assistant asked Dr. Brown if they should call 911, and Dr. Brown said no or wait. That was biggest thing that he should not have done. Instead of calling for immediate emergency care for his wife, the plastic surgeon shouted at his staff, demanding to know what medications she took. Approximately 10 to 20 minutes after his wife suffered the seizure, Benjamin finally asked an assistant to call 911. She was taken to Ascension Sacred Heart Emergency Care Department in Pensacola, where she spent a week in a coma before she died. So this is just a crazy story. This guy has been arrested, which, I mean, good reason, because my gosh. So there's a lot of things that are wrong here. Of all that stuff, what do you feel is the most egregious part of this whole story?
I mean, besides all of it, just the fact that she did everything herself, like the IV bags, taking whatever pills looked nice and colorful, and then suturing herself. She's not trained.
Could you imagine having an operation and you're looking down like, hey, are you done? Let me finish the suturing myself.
I wouldn't even know where to start.
So yeah, a lot of crazy things here. It looks like the actual operations that he was performing, muscle plication, abdominal scar revision, which means probably she had had a tummy tuck. He was going to revise the scar, meaning probably remove a portion of the scar. And then while he was there, maybe lift a little of that skin up and tighten her muscles a little bit. Meaning that normally when we do a tummy tuck, we tighten up the muscles of the abdomen, the rectus muscles, literally all the way from top down. So all the way from the top of the abdomen, all the way down to the pubic area. Basically, it's like an internal corset of sutures that we bring the muscle back together. It sounds like what he did was a revision where maybe she had a little bit of recurrence or looseness maybe in the lower tummy, and he went to restitch some of that as well as revise the scar. He did some liposuction of her upper arms, which is a pretty common procedure, lip injections, which are pretty minor, and then ear adjustment procedures, meaning that maybe he was bringing her ears, pinning her ears back a little bit. None of these are operations that somebody should die from.
No.
And even if you combine all of these together, it's not so much that anybody would look at it and be like, oh my gosh, why are you doing this all at once?
Right.
So that's not the issue here. The issue is going to be the fact that she prepared her own IV bags and ingested a handful of multicolored pills. So we don't know what medication she was on. As far as the IV bags, my guess is she was making IV bags of tumescent. Tumescent solution basically is anesthetic solution that we inject when we liposuction.
Okay.
So it numbs an area up and it lowers the amount of bleeding from that area. When we create these products, and I use these almost every day when I'm in the operating room, we have a specific amount of concentration of lidocaine, of that numbing medicine that we put in, because we know that there's a certain point where you reach toxicity levels and you don't want to get to that.
Right.
So she's preparing her own bags, no formal medical training. So God knows how much lidocaine she was putting into these bags, and obviously taking these pills. So he starts injecting possibly from the bag, possibly from a local anesthetic. And then when she started becoming restless and her feet begin twitching, that should be assigned to any surgeon, any doctor doctor that there's a problem going on here, probably with lidocaine toxicity. And what can happen with lidocaine toxicity is that essentially your body goes haywire. You can get seizures, you can get cardiac arrhythmias, you can die from it. So the first sign of anything like that, number one, you got to dial 911, EMTs come in, you got to bring them to a hospital, and then there's certain medications and IVs and things that can help to basically dilute down the lidocaine and can hopefully reverse some of that. And so it's a huge deal, you know, anybody who has this. And then it sounds like what he ended up doing, she starts suturing her own freaking skin, which is insane. I mean,
I don't know why he would let her do that though. That's what I want to know. Did he just want to like
lazy?
Probably. He just wanted to
like,
continue.
You do it. It's your body. You do it.
That's ridiculous.
Yeah, I've never seen that. Although I have seen once a video of a surgeon liposuctioning his own tummy.
Okay, but he's trained to do that.
But he's liposuctioning his own tummy. So anyways, so when her vision starts to blur, everything starts looking orange, like all of this, any doctor worth anything would know that this is an emergency situation and you've got to call 911, get the EMTs in, you get fluids going. And of course, he didn't do that. And then the fact that he's kept injecting her with lidocaine after she's unresponsive is insane. Like, because that's what's causing the issue. And now he's injecting more, which just insane.
What if he did it on purpose?
Well, I mean, you know, he's up for manslaughter. So, you know, there's a question, 2nd-degree felony homicide, manslaughter by culpable negligence. So that's negligence, which, I mean, I'm not a lawyer, but I'm assuming it's negligent behavior versus like, it would otherwise be 2nd-degree murder if he wanted to actually kill her. Who knows what he was thinking? I mean, just a fool. Like, my God. And then waiting 10 to 20 minutes, what sounds like happened, she had seizures. She may have at that point had some arrhythmias going on. Her blood's not going to her brain anymore. And my guess is she had an anoxic brain injury. And I mean, and it's this guy's fault. Like, there were many times during this process that he should have called 911 and he didn't. And that was why I completely agree with this whole manslaughter by culpable negligence. Like, you can't, you know, you've got somebody's life is in your hands, and to be so egregiously stupid about it, it's just crazy. So, yeah.
And the fact he let it happen to his wife, like, imagine how he treats his patients. Like, obviously you love your wife more than your patients. So if that's happening to your wife and you're not stopping.
If you're having surgery and your surgeon says, hey, suture your own incisions while I go to the next part of it, then that's a bad thing.
Rest in peace.
Yeah. But I tell you, I'm a surgeon, and there are surgeons that you hear stories of, even people in my area, where they're in such a hurry to finish the operation. You know, there's a story I heard from, so we oftentimes will use assistants to help us with some of the suturing. So if I do a breast reduction, then oftentimes like Devin from our office, she's a PA, will come and help me in the OR. I do all the cutting, I put everything together, I measure everything out, I do all that stuff, but then she will help me with holding retractors, and then she'll help me with some of the suturing because, she does a great job, and you can't tell. She's trained. You can't tell when we're done, like which side she did, which side I did. It looks exactly the same, which it has to. If it doesn't, then we redo it.
Yeah.
And if I didn't have her, then the operation could take another 45 minutes to an hour. Yeah. And not only is that, it's better for the patient because you want to get them off the operating table as soon as possible.
Right.
And so, but there are surgeons that I've heard they're in such a hurry to finish the operation that they pressure their assistants, like suture faster, suture faster, suture faster. And you hear stories in the OR about some of these surgeons that they just don't care. And it's like, it's crazy.
It's scary.
This is egregious. I don't hear anything this egregious here in Detroit necessarily, but some of the stories we hear, it's out there. And if you want to hear it, I think last time we talked about the whole ghost doctors, and I told the story about the doctor here in town, and he was basically using quote unquote good ghost doctors. So if you are interested, ghost doctors performing plastic surgery where, they put you to sleep and then a different doctor than the one you think is operating you comes in, they help perform the surgery, and before you wake up and know what's going on, they're gone and you don't even know they were there. That happens. Went over all that in a podcast from probably 3 or 4 weeks ago, the last hot topic. So if you're interested, check that one out. Okay, so a couple more things I'd like to cover that I think are kind of interesting. There's a study from the Aesthetic Surgery Journal found that 25% of plastic surgeons are prescribing GLP-1 agonists in their practice. GLP-1 agonists are basically the weight loss drugs, Ozempic, Wegovy, Mounjaro. 30% of the plastic surgeons who responded were using it for themselves too, of which 70% were using it for cosmetic weight loss. So the GLP-1 agonists like Ozempic can be used for type 2 diabetes. And so in the study, it found that 30% of the plastic surgeons who were responded to this. Like literally 30% of the plastic surgeons were using it. Of the respondents of this survey were on Ozempic or one of those medications. And 70% of them were using it for cosmetic weight loss, not necessarily for medical issues. 82% prescribed it as part of a weight loss center or a medical spa, and 56% prescribed it in preparation for weight loss surgery, which I found to be interesting. They're prescribing it to help patients lose weight so that they can perform weight loss surgery on them afterwards, like skin removal and stuff. Okay, my whole take on this, and I've been public with it, is I have issues with plastic surgeons injecting these medications on patients.
I agree.
My main issue is I think it's a money grab. I really do. Like you have a patient who comes in and once a week they come in, you inject them. Insurance doesn't pay for it. So oftentimes these are compounded. So it's in which case you go to a compound pharmacy, they compound the medication, you pay them for it, then you charge the patient for it. And obviously you charge them extra because you inject it.
Right.
And then 1 week later they come back. And I saw one video of a plastic surgeon where he was answering the question of how long do I need to be on Ozempic? And his answer is you can be on it forever, which honestly, it pisses me off because, you know, our field is filled with grifters and people who are just in it for money. And so my feeling with this, and I have people called much about, you know, saying, hey, anything about Ozempic or asking if we do it?
No, actually, no.
You haven't heard that yet? Because I don't advertise it or anything.
Right.
We don't.
Nobody's asked. Now I'm going to pay attention though. Nobody's asked though.
So the issue that I have is that, you know, I think people's weight issues are such a complex problem for people.
Right.
You know, it's not as simple as you need to stop eating so much, you know, or you should calories in, calories out. Like it's so much more complex. And I don't think that weekly shot is the answer for most people.
I agree.
Permanently. I feel like it can help bridge people into hopefully a healthier lifestyle. And the hope is that you take somebody who's got, weight issues. And we're not talking about people with type 2 diabetes, like that's separate, but just for cosmetic weight issues, to me, what makes the most sense is if, you know, is having a hard time, they're doing traditional weight loss therapies and it's not working before going to surgery, then it makes sense. Like it's better than doing surgery. But the hope then is that you can bridge them hopefully into a better lifestyle that they can maintain and hopefully get them off these medications. But that's not necessarily in the best interest of the surgeons who are injecting it because they want to make the money. And so there are some doctors who I know who are doing this as part of a weight loss center, which, you know what, by all means, I got no issue with that. But I know of plastic surgeons who are cosmetic doctors like me, and they just inject it because it's easy. And, you know, they don't have nutritionists. They don't have dietitians. They don't have life coaches, health coaches to help these patients who need help. But hey, you know what? They can make easy money by injecting them with Ozempic.
Yeah. I mean, I feel like it's a lot safer to get it through like your actual primary care doctor who actually cares about like your health, like what's happening on the inside of your body, like all of those levels.
And you have to get a bunch of labs and stuff, and you've got to monitor your labs with these types of medications. I agree with you. And I think that there are obesity specialists out there. Like that's fine. But I mean, when you're talking about 30% of plastic surgeons who responded to this survey are using it for themselves, and 25% of plastic surgeons are prescribing it in their practice. So 1 out of every 4 plastic surgeons are injecting weight loss medications. Like, what do we know about that? If you go to this meeting, so this is the Aesthetic Surgery Journal, the aesthetic side. If you go to their meetings, I go to their meetings every couple of years. I mean, what do we have? They provide lunch at these meetings, and what are they? They're like, you know, the sub sandwiches with everybody's drinking like with soda pop and chips and cookies. And like plastic surgeons aren't weight loss specialists. We're not dietitians. We don't know crap about this stuff. Like I know because I've been studying this for years now, but the average plastic surgeon, before I did start studying it, I didn't know anything about it. The average plastic surgeon doesn't. So I just find it really to me is a major turnoff. I think
I agree.
I don't think that it's doing the right thing for the patient.
No.
So, okay, a couple more things I'd like to cover I think are kind of interesting. There is a trend towards these cat eye and fox eye surgeries. So I don't know if you have seen, there are videos out there. I think that the most prominent examples that people think have had these procedures. So these are procedures, cat eye and fox eye surgeries are procedures where basically you take the corner of the eye and you slant it up. And people used to, when I grew up, they would make fun of me by doing that to their eyes. But now people are doing that on purpose because they want to look that way. And there are 2 ways to do this procedure. You can do it surgically, where you actually detach the corner of your eyelid and you can reattach it into a higher position. That's called a canthopexy. That essentially is permanent. Or people are using threads, where they take barbed sutures and they go basically from the temple area to where the brow is. And those threads basically, because they're barbs on them, if you pull them under the skin, they will kind of attach the skin and help pull up for a few months. And so there are certain celebrities. Can you name any celebrities you think may have had something like this done?
Bella Hadid. She's the one I always think about.
Yeah, I think she's the one that's most commonly believed to have had it. I agree with you.
Hailey Beaver, maybe?
Has she?
I don't know. If you look at old pictures, her eyes are very different now.
So I never comment on Justin and Haley because I'm friends with Justin's mom.
I'm in danger.
Okay, never mind.
But you can say what you want. That's not from me. I have no comment. I think Haley looks great.
I'm sorry.
She's pregnant now and they've got a baby coming. So I'm very happy for them. But yes, no, I'm friends with Justin's mom. Every so often we'll text each other. So I get people ask, like the tabloids ask me about, and I can't say anything about Justin. Yeah. No comment.
I'm sorry, I didn't mean it.
No, it's all good. So then there's also, I think Ariana Grande possibly. Mm-hmm. And then the other one is Kendall Jenner, I think may have at some point.
Yeah, I agree.
Yeah, at some point it's kind of. So anyways, these have become popular. I'm not a fan of these. So the thread lift versions, you literally will get 3 to 6 months out of it. Mm-hmm. And those threads can leave behind scar tissue. Right. So I'm not a fan of the threads.
No, it's
not. And then the canthopexy really is a reshaping of your eye. And you will look different if you have it done. That's a permanent change. It's something that I really only recommend for people who are literally, if you feel like you've got kind of like hound dog eyes going on, then I think it can be a reasonable procedure. Mm-hmm. The doctors who do that procedure are typically ophthalmic plastic surgeons. These are ophthalmologists who have specialized training in plastic surgery of the eyes. And if you go online on TikTok and on Instagram, there are some just out there versions of these cat eye surgeries. A lot of them are coming out of Asia where literally they're pulling them so tight that they can't open their eyes afterwards. And I'm not exaggerating that their eyes look like this after the operation. It is crazy. And eventually things settle down, but it's just what they're doing out in Asia. It's nuts sometimes. I think they're so plastic surgery obsessed in like Korea and some of these other countries out there that it's going absolutely bonkers. And it's almost all on women that they're doing this. Mm-hmm. It's unnecessary and it's a real bummer.
I think they're very interesting surgeries, but you'd think that makeup can kind of do the same thing. Not like as extreme. So it's maybe like try it out with makeup first and then it's like, oh, maybe I do want it. It's like,
because you can do like, is it your eyeliner? You can do and create that kind of coming up this way.
Even with eyeshadow, if you put tape down like diagonally and you like do your makeup, whatever, and you peel it off, it's like a perfect like straight line.
Yeah, that's totally the way to do it.
Yeah,
or the other thing, you combine that, and if you do some Botox, which is so much safer, and you just Botox coming up in a V shape like this, and if you just do just a touch underneath the orbicularis, underneath the brow edges where you get your orbicularis muscles, then you can get kind of an arching of the brow up. You combine that with the makeup.
Yeah, try it temporarily first, and then if you really do go for it. It's all you.
I agree with you. All right, one final story I want to cover. This is something a little more in depth that is interesting in the plastic surgery field. And this is a story out of Allure magazine. So last fall, one of the world's most respected facelift surgeons, Dr. Mike Nyack, posted a video on Instagram comparing two faces mid-surgery. One had received hyaluronic acid fillers in the past, the other Sculptra, a collagen-stimulating injectable. And we inject both Sculptra and hyaluronic acid fillers in my office. The tissues in the first face, the hyaluronic acid filler face, appeared glistening and smooth with delicate nerves on display, while the Sculptra-treated tissues are bumpy, bloody, and chaotic. I don't know how you can describe chaotic in the appearance of somebody, but okay. So are there treatments that can make future surgery more difficult? Well, what are the odds that future surgical complications arising from treatments like Sculptra? Well, we don't know the answer to that yet, he says, but unless you've completely ruled out a facelift, this is a risk to be aware of because non-surgical interventions can alter the tissues in ways that make surgery more arduous and less predictable with a rougher recovery. In an online poll conducted by my good friend, Dr. Christian Subio, 82% of doctors reported finding significant scarring in facelift patients who had used Sculptra or other so-called biostimulators. And these are injectables that spur collagen synthesis like Radiesse. 64% rated the effects of thread lifts as equally or more concerning. In a separate 2023 survey of 156 plastic surgeons from the Aesthetic Society, more than half claimed that repetitive full-face filler injections, namely Radiesse and Sculptra, make facelifts trickier to perform. So this is something, basically what they're saying is there is a concern that if you get injectable fillers, especially the biostimulating fillers like Sculptra and Radiesse, that they can essentially leave behind scar tissue that can make the actual surgery of a facelift more difficult. And this is something that I agree with. I have seen that in my own patients. And sometimes even we find if patients have had a lot of filler, whether it's an HA filler or Sculptra may be a worse offender. We find that the needle, it gets harder to kind of dissect through the tissues or go through the tissues if they've had a lot of treatments, because I do believe that there's scar tissue that kind of develops. Now, there's some good and bad. There are some patients where we do injections of filler into their lips or into their nasolabial folds. And after regularly doing it for a few years, it seems to not really go away.
Okay.
Now, is it that the filler sticks around for years, or is it scar tissue that builds up? Who knows? But there can be a beneficial effect for some people. On the flip side, if you're having a ton of filler injected, especially in the lower face or in the neck area, then it's possible, if you're going to have a facelift later on, that could potentially make that facelift operation harder, essentially creating a bunch of scar tissue. Now, when we do revision surgeries and I relift a face after it's been done before, it's the same issue that we have, is we basically have this layer of scar that can be difficult to dissect through and know how deep you are, how superficial you are. So it's a similar idea, except with fillers, it may be a bit more haphazard because it's kind of in all the different layers. So this is something that has been a discussion. The interesting thing is that the filler companies try to poo-poo it.
Yeah.
And because obviously they make a lot of money off the fillers. But something, if you're considering having, let's say, a facelift in the near future, and you are a regularly get injections of filler, if you get filler, let's say up in the cheek areas, then it's unlikely to really impact a whole lot. But if you're doing filler, let's say in the jowl areas, along the jawline, I don't know why you'd be getting much in the neck, but in that area, then just keep that in mind and talk with your surgeon to make sure that they know that could be an issue, or maybe stop doing it, because that may help things to settle down prior to an operation.
Yeah, I've had people call asking, like, they want a consultation with you and like a facelift or whatever. And they ask, is it okay if I have filler?
Yeah.
And I was like, well, I don't know. So I asked Megan. She said, it's not a huge deal, but like maybe tell them to dissolve it first.
It depends on the location that they have it and where they operate. And same thing with like Botox. If I'm doing a facelift, some people ask, hey, can I get Botox before? Well, if you're getting Botox in your forehead, in your crow's feet, in your frown lines, and it's no big deal, because that's not where I'm operating. But if we're doing a blepharoplasty and they're getting Botox in their forehead, then that can really impact it, because it can cause the brows to be in a different position. Maybe I cut too much skin out. Maybe I don't remove enough. And so in those situations, we always want it to wear off. So
it's interesting.
It is constantly changing. So I hope you all enjoyed this week's podcast on hot topics in cosmetic surgery. We'll be back in about another month or so to do another one of the newest news in cosmetic medicine. As always, if you get a chance, please leave a rating or review of this podcast on iTunes, Spotify, or wherever you get your podcasts. It definitely helps me spread the word. I'm Dr. Anthony Youn, America's holistic plastic surgeon, and this is the Dr. Youn Show. Thank you so much, everybody, for watching and listening. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.